Let me ask you something that might just change the rest of your life. What if I told you that one powerful but often overlooked daily habit could add years to your life without requiring any crash diets, demanding workout routines, or complicated lifestyle overhauls? What if this same habit could support your metabolic health, help maintain strong erections, and reduce your long-term risk for some of the most common chronic diseases affecting men today? This isn't clickbait. This is clinical reality, supported by high-quality research and grounded in physiological science. Gentlemen, we're talking about fiber. Yes, dietary fiber. And the evidence behind it is not only compelling, it's transformative. Now, men aged 65 have a life expectancy of around 83 years on average. But incorporating just 20 extra grams of fiber daily may extend that outlook by another 2 to 4 years. Start at 55. You could gain 5 more healthy years, potentially even 7. Begin in your 20s or 30s, and the cumulative benefit could approach a full decade. These aren't fringe estimates. These are conservative projections based on large-scale human data. As a physician, I don't deal in hype. I deal in outcomes. So let me walk you through why this matters, how fiber actually works inside your body, and how you can start incorporating the right kind today. Let's look at the clinical evidence. In 2019, the Lancet, one of the most respected medical journals in the world, published an expansive meta-analysis including data from 188 observational studies and 60 randomized controlled trials. That's over 4,500 participants in tightly controlled environments, plus observational data spanning hundreds of thousands more. The conclusion? People consuming between 30 and 35 grams of fiber per day experienced a 15% to 30% lower risk of premature mortality. That's on par with what we sometimes see from pharmacological interventions, except this doesn't need a prescription. Even more compelling is the long-term view. The NIH AARP Diet and Health Study, which followed over 395,000 adults for nearly a decade, found that men with the highest dietary fiber intake had a 25% lower risk of death from all causes compared to those with the lowest intake. Not health nuts. Normal men. Just making a different decision at the grocery store. When you consistently give your body the fiber it needs, your vascular system performs better. Your digestive health stabilizes. Your cholesterol levels shift in the right direction. And yes, your erections stay stronger, longer. Let's talk mechanisms. Because understanding why this works is just as important as knowing that it does. Dietary fiber, especially soluble fiber, is fermented by your gut microbiota into short-chain fatty acids, including butyrate. These bioactive compounds reduce systemic inflammation and improve insulin sensitivity. And that matters because chronic inflammation and metabolic dysfunction are the twin engines behind many age-related diseases: cardiovascular disease, type 2 diabetes, and yes, even erectile dysfunction. What's the link between fiber and arousal? It's all about vascular health. Erections depend entirely on proper blood flow. When your endothelial lining, the inner walls of your blood vessels, is inflamed or stiffened by high LDL cholesterol or blood glucose spikes, the of your arteries to release nitric oxide decreases. And without sufficient nitric oxide, your blood vessels can't dilate optimally. That means less blood reaches your penile tissue when it should. In fact, erectile dysfunction is often one of the earliest signs of cardiovascular decline, sometimes years before the first cardiac event. Now imagine this. Improved fiber intake reduces LDL cholesterol, stabilizes blood sugar, and improves endothelial tone. In doing so, it reinforces the very foundation of a healthy erection. One clinical trial, published in the American Journal of Clinical Nutrition, found that supplementing with psyllium husk, a potent soluble fiber, lowered LDL cholesterol by 5 to 7% in just a few weeks. Other studies have shown modest but significant reductions in blood pressure, about 2 to 5 millimeters of mercury systolic and 1 to 3 millimeters of mercury diastolic. These are meaningful shifts. When taken together, that improved vascular flexibility translates into more reliable sexual function and a longer, healthier life. Now, I know many of you may be thinking, but fiber is a carbohydrate, and I'm on a low-carb diet. Doesn't that conflict? Here's the thing. Yes, fiber is structurally classified as a carbohydrate. But no, it doesn't behave like typical carbs in your body. Soluble fiber is non-digestible. It doesn't raise your blood glucose, it doesn't elicit an insulin surge, and it most certainly doesn't kick you out of ketosis. In fact, you can maintain a ketogenic or low-carb lifestyle and still reach optimal fiber intake if you're smart about your sources. Let's get practical. Psyllium husk is one of the most effective soluble fibers, composed almost entirely of non-digestible bulk. A simple protocol? Start with 5 grams once per day in a large glass of water. Stir it briskly and drink it immediately, before it thickens. In week 2, move to twice daily. In week 3, take it before all 3 major meals. That routine alone gives you around 30 grams of fiber per day, which is the therapeutic zone shown in research. Next, add 2 tablespoons of ground flaxseed to your morning yogurt, oats, or smoothie. That gives you another 7 grams, along with plant-based omega-3 fats and lignans, which are well documented to support prostate function and reduce inflammation at a cellular level. You can also consider inulin, a prebiotic fiber that nourishes your beneficial gut bacteria and enhances glucose control. Even low-carb vegetables, like spinach, broccoli, cauliflower, Brussels sprouts, carry meaningful amounts of insoluble and soluble fiber that, over time, compound your health benefits. What we're talking about here is synergy. Low-carb nutrition reduces insulin surges and promotes fat metabolism. Fiber supports your vascular system, improves digestion, and lowers chronic disease risk. Together, they don't cancel each other out. They enhance one another. And if you're the type of person who needs to see results to believe them, good. Because you'll feel this. Expect more regular digestion in a matter of days, more stable energy within a couple of weeks, and within 1 to 2 months, the impact on your vascular function may be substantial enough that you notice improved erection quality, greater stamina, and a clearer head. One double-blind randomized trial published in the Journal of Nutrition in 2018 showed that men taking 21 grams of psyllium per day significantly improved both LDL cholesterol and key markers of endothelial function after just 6 weeks. Of course, if you're on medications for hypertension, diabetes, or cholesterol, please consult with your physician. The improvements from fiber intake are so significant that your medication dosage may need adjustment. This is a good problem to have, but it requires supervision. My mission is clear and unwavering. I want every man to gain 10 healthy years of life. The research shows that fiber may very well be the lowest hanging fruit to get you closer to that goal. And the best part? You don't have to revolutionize your entire lifestyle. Just this one simple, powerful adjustment can help build a longer-lasting body and a stronger, more reliable you. So, if you've made it this far, let me say this. You've already taken the first step toward a stronger, healthier, and longer life. You're not just watching a video, you're investing in your future. And trust me, most people don't. But here's the truth. Knowledge only changes lives when it turns into action. So don't let this just be another video you watched and forgot. Start today. Try the simple plan I outlined. Feel the difference. Then share it with your brother, your father, your best friend, because every man deserves to know this. And if this helped you even a little, help me help more men by clicking that like button. It signals YouTube to show this to others who need it. Don't forget to subscribe and turn on notifications so you never miss scientifically accurate, life-changing content delivered by a doctor who's here for one reason: to help you live stronger, longer, and without limits. You're not just adding fiber, you're adding years. You're not just protecting your heart, you're reversing your erections and reclaiming your power. Because anything which is good for your heart is good for your penis.